Hello everyone. Today we are going to be giving to you a presentation on managing depression. This is going to explore a little bit about what depression is. We're going to talk about some common symptoms of depression, when you may want to talk to a counselor, reach out to a mental health professional, or reach out to friends and family, how maybe you can be that person for someone else, reaching out to others who may need a hand. We're going to talk about some tips and some strategies for managing our depression, and I want to welcome you to this online presentation of managing depression. So no conversation about depression would really be complete without, at the very least, touching anxiety just a little bit. Anxiety and depression are really flip sides of the same coin in many ways. Individuals who suffer from symptoms of depression are significantly more likely to have symptoms of anxiety and vice versa. And you can see here in this Venn diagram that actually some of the symptoms themselves tend to overlap. The restlessness, excessive worrying, and agitation are both kind of common symptoms of both anxiety and depression. So one of the things that I think sometimes gets lost in this conversation about depression is everyone's experience is really unique. Everyone experiences a unique set of symptoms, and everyone experiences the world in a really unique way. And sometimes art can actually help us to capture things that our words can't always describe accurately. So these are three paintings here done by some pretty famous painters. The first is by Van Gogh at Eternity's Gate. The second one is Black and Deep Red by Rothko. And the third is The Absinthe Drinker by Edgar Degas. And these are three that I think really capture unique aspects of depression that might not always be really perfectly captured in the language and the words that we use. And having said that, I think the words are of course really important, and I don't want to discount our ability to have a conversation about them, but it's sometimes helpful just to see things from a little bit of a different perspective. So looking through the Diagnostic and Statistics Manual of Mental Disorders, the DSM-5, we see some symptoms of depression, and these are this is not an exhaustive list, and this should not take the place of a consultation with a mental health professional. These are more symptoms that maybe if you are experiencing a few of them, you really want to keep that in mind and maybe consult with a mental health professional. So some common symptoms of depression include low mood, sadness, apathy, loss of interest or pleasure, changes in sleep. This could be an increase in sleep, hyposomnia, a decrease in sleep, having trouble falling asleep, staying asleep, insomnia, appetite changes, eating more than usual, eating less than usual, weight gain, weight loss, lack of energy, fatigue, isolation or social withdrawal, difficulty concentrating or hopelessness, low self-esteem, worthlessness, thoughts of death or thoughts of suicide. And really, if you're having that last one, thoughts of death or suicide, consult with a mental health professional or call 911 immediately. That's not something that you want to wait on, but really just keep these in mind as a general guideline for symptoms to really be concerned about if you're experiencing. So how can you tell if you are depressed? This is back to that concept of feeling sadness, feeling disappointment, grief, loss, are all normal reactions to life. We all experience those negative emotions, and occasional feelings of loneliness are just really part of the human experience. What we really want to focus on is the duration and intensity, the length and how strongly you feel the things that you're feeling. So feeling persistently down for a significant amount of time, days, weeks, months, feeling helpless and hopeless for again, days, weeks, months at a time, losing interest in things that you once enjoyed, poor sleep and having no energy or low energy, and trouble concentrating, again, at a really high level and for a really long time. I don't want to get too much into the specifics of time, and intensity is somewhat subjective, but just keeping those two kind of dimensions in mind, is this something that's been going on for more than a couple of days, more than a couple of weeks? Is it something that's really getting so bad that it's interfering with your ability to function as a human being in your life? Are you unable to go to school and get the grades that you know you can get? Are you unable to work? Are you unable to do the things that you really need to do? Or is the depression just kind of taking over your life? So let's take a look at some myths about depression. Myth number one, medication is the best treatment for depression. Why don't you take just a second and think about that answer? Well, the fact is that treatment for mental health problems, for depression specifically, they really vary depending on the individual and could include medication, therapy, lifestyle changes, or any combination of these. So just like how depression manifests uniquely in every single person, the treatment for it is going to be unique for every single person. Myth number two, you can tell when someone has depression. So what do you think? Take a second to think about the answer to that one. The fact is that no, you cannot always tell when someone has depression. People have actually, many people with depression have gotten very, very good at hiding their problems and their struggles. That's actually part of the concern, part of the issue is that people don't seek help and they actually learn to hide and try to avoid and try to mask that from other people. So actually asking for help is really one of the first steps towards dealing with it and accepting it and working towards making it better. And you're not always going to be able to tell when someone has depression. This is a really great quote here. Everyone you meet is fighting a battle that you know nothing about. So really being kind to every single person that you meet because you have no idea what they're going through. So there's a couple different types of depression, and types is kind of loose, in quotes there, a loose type. You don't want to get too focused on the diagnostic aspect, but just being aware that there's different ways that depression can really manifest in every person. There's some pretty big differences in the ways that they look to different people. You can get a major depressive disorder. That's kind of your classic depression where someone experiences low mood, sadness, loss of interest in things, hopelessness. And then we have something called persistent depressive disorder or dysthymic disorder. And that's kind of a more low-level depression, but it goes on for a really long time. And then there's seasonal pattern specifier type of depression. That's someone who may have seasonal affective disorder or SAD, someone who can have low mood depending on the season. And then there's bipolar depression, individuals who may experience having ups and downs, having manic episodes or hypomanic episodes where they may have decreased need for sleep or feeling like they're kind of on top of the world and having a lot of energy and being impulsive, and then kind of having both those manic episodes and depressive episodes where they're feeling really down and feeling low mood, hopeless, worthless. Then there's adjustment disorders, type of disorder where an individual has difficulty transitioning given a certain stressor. And it can look a lot like depression, but really be the result of a specific change in their life and typically isn't quite as severe as major depressive disorder. So what causes depression? This is one of those questions that I get asked a lot by clients coming into my office for the very first time. They say, why do I feel anxious? Why do I feel depressed? Why do I experience the world in the way that I do? And the answer to this question is almost invariably, it's a lot of different things. It's probably a lot of different things and a combination of different things working together. Sometimes painful events can lead to depression. For college students, a lot of times, adjusting to the increased responsibility of adult life, moving away from home, and the pressures to excel can all trigger depression or worsen underlying depression. Depression does run in families. The heritability coefficient, or the amount that a disorder is transferred from mother and father to their son or daughter, for depression, it's somewhere about 30% for men and 40% for women. Depression may happen because of changes in your neurochemicals. So just kind of the way that our bodies operate sometimes, just because of no particular reason, or because of a complex series of physiological changes, you can have changes in the neurochemicals in your brain that cause depression. Lack of effective coping skills and stress management, unrealistic standards and assumptions about what one should do in life, or pressure to excel, or even just changes in season. So many different things can cause depression, and so many different things can make underlying depression worse. So depression in college, on college campuses and college students, about 25% of young adults experience a depressive episode before the age of 24. 30% of college students reported being so depressed that it caused difficulty with their functioning. And 45%, nearly half of all college students, reported feeling hopeless one or more times in the last year. Let's take a look at a few myths about suicide, because a lot of people, most people rather, that attempt suicide experience a number of symptoms of depression. So myth number one, you have to be crazy to even think about suicide. And the fact is that most people have thoughts of suicide from time to time. Most suicides and suicide attempts are made by people who really feel hopeless and trapped and feel that they have nowhere to turn to, especially in the midst of crisis. Let's take a look at depression and suicide. Suicide is the second leading cause of death among college students. And if you think about it, the second leading cause, if you add up all of the potential causes, car accidents, heart attacks, strokes, everything that you can possibly think of, all of the medical conditions, suicide is the second leading cause of death among college students. That's a huge number. And 8% of college students reported seriously considering attempting suicide. And 2% of all college students have attempted suicide. So let's take a look at some myths about talking to people with some suicidal thoughts or some severe depression. Here's a myth for you. Talking to someone about their depression or suicidal thoughts will make it worse. The fact is that friends and loved ones can really make a big difference. Only about 44% of adults with diagnosable mental health problems and less than 20% of children and adolescents receive needed treatment. Friends and family can be important influences to help someone get the treatment and services that they need. So reaching out and letting them know that you're available to help, helping them access mental health services, and learning and sharing facts about mental health, especially if you hear something that isn't true. And, I think one of these big myths that kind of go along with this is that by asking someone if they're feeling suicidal, you might kind of put that idea into their head. And that's entirely untrue. By asking if someone's suicidal, you're never ever going to make them suicidal. You're not going to give them that idea. But you may actually help someone who may be actually struggling with some suicidal thoughts to open up and to talk to someone. If you're feeling suicidal, talk to someone right away. This is one of those things that doesn't need to wait. Call the suicide emergency hotline or 911 and go to the hospital, contact your mental health center, or call the police department. Develop a plan to make sure that you're not by yourself and don't use drugs or alcohol. Make sure that you don't have access to things that can cause injury like guns, knives, and medications. So now we're getting into talking about managing depression. And these are the things that we can do when we're experiencing some of those symptoms: hopelessness, lack of sleep, sleeping too much, feeling hopeless, worthless, down, sad, crying, isolating, withdrawing, What can we do to manage some of those symptoms? So one of the first steps can be just identify some of the things that might be contributing to the depression. And this isn't some search for some deep root cause that's the root cause of all of your problems. This is maybe kind of thinking a little bit like a scientist and thinking about what might be some of the things, some of the variables that might be impacting your depression. If you're drinking more than usual and you're feeling more depressed, maybe thinking, could my drinking be one of the kind of concerns right now for me, and one of the things that I need to be a little bit more mindful of? Maybe I'm not getting enough sleep, or I'm working a bit too hard and I need to take a little bit of a break. Maybe that's one of those variables, those things that you just need to be really mindful of. Or maybe you're not getting enough physical activity. Or maybe you're not eating a regular, well-balanced meal, maybe eating a lot of fast food and kind of eating a lot of sugary, high-carb kind of food, and you're not eating enough fruits and vegetables. And again, it's getting enough sleep, enough good sleep too. And we're going to talk, there's actually going to be a specific section here where we're going to talk just about getting good sleep, because that's absolutely imperative to our both physical and mental well-being. So let's take a look at some more ways to manage depression. Seeking emotional support. Again, this could be friends or family members, or kind of searching for a counselor in the area. And seeking emotional support means having meaningful conversations and having a connection with someone that's beyond just, hey, how are you doing, or what's up? But it's having that person that you can share what's really going on with you, and having someone that you can connect with in a meaningful way. Another way to kind of help us manage our depression is to focus on some positive aspects of life. Gratitude, journaling, exercises, getting some physical activity, doing some meditation, some being intentional about your awareness in the moment. We can also learn to pace ourselves and modify our schedule and set realistic goals. A lot of college students, one of the major causes for depression for college students is this unrealistic expectation that you're going to get straight A's and be the captain of every team and be a leader on every single club, in every single club that you're a part of, and do all of these things and be this superhuman person and never get down, and never struggle, and never feel sad, and never cry. Having realistic goals, maybe getting mostly A's and giving yourself the okay to get maybe that one B, or be really good at one thing and maybe be the captain of one team and be the president of one club, or take on one big responsibility, but not maybe 20. Scheduling an appointment to see a counselor can obviously help you to manage your symptoms. You can meet with someone and they can review your symptoms and concerns and work with you and be that emotional support that maybe you need in the moment. Another thing to remember is, as I mentioned earlier, anxiety and depression are kind of like opposite sides of the same coin. And managing our anxiety in order to manage our depression, and vice versa. Remembering that many of the symptoms actually overlap between depression and anxiety, and accepting that you may have symptoms of both and that you may need to manage your anxiety as well as your depression. Being honest about how that anxiety manifests, and being aware of how that comes into your life. You can feel free to check out our Managing Anxiety presentation and talk to your counselor about any concerns about anxiety if you have them. So just like with depression, there are some signs and some cues that maybe you want to be aware of if you're feeling really stressed or feeling a lot of anxiety. And just like the symptoms themselves, some of these cues might tell you that you're experiencing some anxiety, and also might tell you that you're experiencing some depression. This is a really good framework for how to organize your thinking around that question of how am I feeling, what am I thinking, what are some of the ways that I'm existing in the world right now that maybe aren't the most healthy, or that are just kind of giving me some signs that maybe I need to look at something a little bit deeper. So this is kind of organized in four dimensions or four areas. There's emotions, there's thoughts, there's behaviors, and then there's our body here. So let's look at each category, each domain, and see how might our body or how might ourselves be kind of telling ourselves that there might be something going on in each of these four areas. So for our emotions, feeling anxiety, feeling that worry about some future event, feeling fear, moodiness, irritability, frustration, anger, all emotions that might kind of cue us in to the fact that maybe we're feeling some stress, some anxiety, or maybe even some depression. Let's take a look at our thoughts. Having a difficult time concentrating, being forgetful, worrying about the future, having low self-esteem. These are all thoughts, different ways that we relate to our thoughts too, that might cue us in that something just might be going on, and we want to kind of put the spotlight there and say, you know, what's really going on right now? And then there's our behaviors, some things that might cue us in without even really just consciously being aware of. Of course, crying, grinding teeth, using alcohol or drugs more often, changes in appetite. Maybe we find ourselves eating more or eating less, procrastinating doing the things that we have to do for work or school. And then there's the body, our physiology, you know, looking at increased blood pressure, increased heart rate, sweating more, muscle tension, maybe our leg is bouncing up and down. There's a whole host of physiological responses, again, just as unique to every single person as symptoms and ways that depression and anxiety manifest. So let's take a look at healthy sleep habits, and this is so incredibly important. Getting a good night's sleep and getting exercise, eating healthy are three things that are typically within your control, at least a little bit. We can always try to go to bed a little bit earlier. We can always try to get our work done earlier so that we're not up, and try to make choices related to healthy eating and getting just a little bit of exercise. But sleep is one that is a big problem for a lot of college students, and one that I know, again, most of the clients that I come in with say, you know, I'm not sleeping well. And one of the questions I ask them is, well, what are you doing about it? What's your game plan for trying to sleep better? And this section of the presentation will help to give you some guidelines for maybe how you can begin to think about your sleep better and how you might go about being intentional about getting better quality and more sleep. So why is sleep so important? I'm going to ask you that question. Think about now, what are some of the things that you know about sleep? And maybe you just know about yourself if you don't get enough sleep. What are some of the signs for yourself that you haven't gotten enough sleep? What are some of the signs that you have gotten enough sleep? So sleep serves a number of functions in our life. It helps to consolidate learning and memories. It helps to rest our body and our mind. Helps to maintain our immune system, which is so incredibly important in this time right now. And it helps us to not feel so exhausted all day. So what happens if you don't get quality rest, don't get enough sleep? There's an increase in all of the things that are associated with anxiety and depression, including irritability and stress, distractibility. And there's diminished ability to focus and think innovatively, decreased problem-solving ability, ability to manage complex situations, decrease in communication skills and abstract thinking. Not only are these the kind of symptoms of anxiety and depression, but they're things that make it worse and make your ability to effectively manage those things worse, which is why sleep is so incredibly important. This is another one of those things that I hear from a lot of clients. A lot of people say, but I don't have enough time to sleep more. And when your schedule is packed, sometimes more sleep isn't always a viable option. But recognizing that you can catch up on sleep when you can, and that's making time for sleep too. And when you can't focus on the quality of you, and when you can't focus on the quantity of your sleep, focusing on the quality is really important too. And that's where some of those sleep hygiene rules of thumb comes into play. Having a cool, quiet environment, making sure that you go to bed at the same time every day, turning off screens at least an hour, preferably 2-3 hours before you go to bed. So not having that blue light shining directly into your eyes right before you go to sleep. Being really intentional about the environment that you plan to sleep in. So here's a few more sleep hygiene tips and tricks and ideas. Thinking again about the timing, both when it is that you go to sleep. Is it 10 o'clock every night? Is it 2 o'clock every night? Is it at the same time every night? And also, if you need to modify because you have a project or something, maybe making sure that it's not wildly throwing your schedule off. So if you need to stay up an extra 15 minutes, great. 30 minutes, okay. Maybe an hour, 2-3 hours. That's getting into the territory of kind of wildly throwing off your entire sleep schedule. So if you do need to modify the schedule, go to bed early or later, kind of modifying it gently and gradually, not drastically, and making sure that it's at the same time every night. And the environment, like I talked about in the last slide, is incredibly important. Keeping the noise level down, having light levels down, maybe putting up a black curtain or a dark curtain to try to keep the lights out, keeping the temperature down lower. Having a pre-bedtime schedule, doing things in a certain order so that your mind and body become habituated to a routine. For instance, like brushing your teeth, combing your hair, taking a warm bath, reading something, reading a chapter in a book, talking to a friend or a partner on the phone for just a little bit, some kind of regular routines that you can get into is really important because it helps again to kind of just guide your body and mind into sleep rather than kind of jolting it and just throwing yourself to bed at a different time and in a different way every single day. Caffeine consumption is really an important thing to remember, and not just right before bed, but thinking about it throughout the day. How much caffeine is really right for you? That's one of those unique, everyone's kind of unique questions. But as you get older, your body is actually going to start to respond to caffeine more acutely. So you're going to actually have more of a strong response to it. And you may need to actually cut back on caffeine. And if you are having trouble sleeping, asking yourself how many cups of coffee or how many energy drinks or how many espressos or whatever it is that you're drinking, soda, how much of that are you consuming right now? The blue light, again, that's the blue light from cell phones and tablets and computers that's shining literally directly into your eyes. It's just shooting light photons right into your face as you're about to fall asleep. And it's kind of just like, you wouldn't want to stare at the sun or stare at a street lamp right before you go to bed. But yet we put these screens directly in front of our faces, which keep us up at night. And also thinking about the activities that we do before bed. You don't want to run 20 miles right before you try to sleep. You don't want to go work out. You don't want to do something that's really engaging or activating. You don't want to call that friend that you're having a fight with a minute before you're trying to sleep, or watch that really, really sad, or dramatic, or scary movie that's going to get your emotions up, get you really activated. You want to do things that are much more relaxing and peaceful. Reading kind of a boring book, reading something that's not going to be really exciting and kind of get you up. Maybe having a gentle conversation with a friend, doing some journaling, just kind of taking some time for yourself right before bed. So here's some further tips on sleeping better. This regular schedule that we talked about before, again, if you go to bed at 11 o'clock every single night, and you need to stay up to do a project or finish something, going to bed maybe at midnight isn't going to completely destroy your schedule. But going to bed at maybe 2, 3 a.m., that is going to really throw your entire schedule off. So 1 hour of both 1 hour before, 1 hour after your kind of typical time of going to bed. And the same goes with waking up. You know, if you usually wake up at 8, you want to sleep in a little bit. Waking up at 9 isn't going to completely throw off your schedule. But waking up, say, at noon, it's going to really throw off your schedule. Engaging in relaxing activities, which we talked about. Limiting caffeine and alcohol. We talked a bit about caffeine, but alcohol is another, it's a drug that can have long consequences for your sleep schedule, and much longer than most people think. Everyone thinks, you know, the effects of alcohol can last a day or two, but when we're talking about sleep, alcohol completely dysregulates your REM, your rapid eye movement, and some of those deep wave sleep cycles that you need. And it can dysregulate and disrupt those schedules for kind of days afterwards, because sleep is all about balance. And once your body and your physiology kind of become out of balance, it takes a while to regain that sense of balance and regain that homeostasis that you need to get good, healthy sleep. So both alcohol and caffeine can really dysregulate sleep, not just for the day or the night that you drink them, but for quite a while afterwards. And developing a bedtime routine, we've talked about this, looking at the cues that your body tells you that you need sleep, and really only using your bed for sleep and sex, nothing else. There's some things that you can maybe do to reduce the blue light that you're experiencing before bed, getting blue light filters for your laptop and phone, and just really skipping TV and skipping Netflix right before you go to bed. So one of the ways that we can manage our depression is this idea of self-compassion, having some compassion for ourselves. I'll talk briefly about what that is and how maybe you can incorporate that into your life. So self-compassion is composed of these 3 components. There's mindfulness, that's that intentional awareness of the present moment. There's this idea of connectedness or common humanity, this idea that everyone has to go through certain things together. And then there's this element of self-kindness, this that we have to be as kind to ourselves as we are to everyone else. It's so much easier to, everyone seems to find it so much easier to be kinder to someone else than it is to ourselves. But when you think about it, there's really no reason that we should talk to ourselves and think about ourselves any differently than we do other people. Acting harshly towards other people doesn't help to motivate them to do better at what you want them to do. So talking harshly and self-critically about ourselves in the same way doesn't help us to get better or to solve the problems that we want to solve for ourselves. So acting with kindness and compassion and respect, and understanding that we're connected to other people and we're no different than other people, and acting in a really intentional and mindful way is just one way of kind of helping to manage some of the depression that we're experiencing. And I encourage you to do some more research on your own. You can go to selfcompassion.org. The link is there at the bottom of this slide. You can read the book called Self-Compassion by Kristin Neff. And you can just maybe I would encourage you to check out some of the exercises on the website there. There's some self-compassion breaks and some mantras that maybe you can look into and do a little bit of reading. And just taking some time for yourself and treating yourself as you would treat a close friend. Just really being intentional about the way that we talk to ourselves, and even maybe just taking a break and saying, how is it that I'm talking to myself right now? And is it kind?